Let's look at the effects of cannabis use on anesthetic requirement. We want to consider the frequency and use and time lapse of the drug when considering anesthetic potentiation. We want to consider the effect of THC on serotonin, on dopamine, and prostaglandins, which makes the estimation of potentiation very, very difficult. Any drug which causes respiratory or cardiac depression may be augmented by cannabis. Severe vascular complications can occur: malignant arrhythmias, coronary spasm, sudden death, cerebral hypoperfusion, and stroke. In view of the wide-reaching physiological effects of THC, consider having the patient avoid cannabis for at least 72 hours prior to any elective procedure. Let's look at how much money each generation is spending on cannabis. Millennials are spending $13.87 each on an average. Generation X, $15.33. Baby boomers, $17.16. And the silent generation, those that are 76 years old and over, are spending a whopping $21.09 each. So that is the hidden group, the geriatric population that is using cannabis to increase pain control, increase with other systemic diseases, and less of a reliance, or to potentiate the use of prescription drug medications. What are some of the physiological effects of cannabis? Well, we can get increased heart rate because of the increase in catecholamines that it produces. We can get vasodilation, or postural hypotension is possible. We can get an increased workload of the heart, and it may predispose patients with coronary heart disease to increased risk of MI or stroke. We can get cardiac depression by its direct effect on cardiac muscles that may appear as pre-ventricular contractions. It can cause cardiac arrhythmias. We can get dry mouth, which can aid in caries exacerbation. We can get impairment of concentration of short-term memory. We can get euphoria, and we can get an increased rate of breathing. Let's talk now about the different strains of cannabis. Indica is often thought as a body high, best for nighttime. I think of it as in the couch. Sativa is more considered a mind high, and it's best for boosting creativity. Sativa, taller, slimmer plants, produces a head high, can make you more alert, is uplifting and euphoric, increases creativity, can increase energy, and is best for daytime use. Indica, the leaves are shorter and wider, produces more of a body high, relaxation. It's an appetite stimulator. It can be used as a sleep aid and can also be used for pain relief, and is best for nighttime use. Let's talk a little bit about CBD. Cannabidiol, or CBD, is a naturally occurring compound found in the cannabis plant. It's derived from the hemp plant itself, specifically the leaves, the stems, and the flowers, and it does not have any psychoactive components. Remember, that's from THC. CBD acts on CB1 and CB2 receptors throughout the endocannabinoid system and can promote homeostasis, reduce pain sensation, and reduce inflammation. CBD has been touted for the treatment of pain, anxiety, psychosis, and addiction, movement disorders, but there is no highly scientific studies that demonstrate its effectiveness. Let's talk a little bit about CBD. It has some antioxidant and anti-inflammatory actions, and it reduces oxidative stress and neuroinflammation. It inhibits FAAH, the enzyme that breaks down anandamide, the naturally occurring endocannabinoid. CBD also is a mild serotonin receptor agonist. CBD also activates the reward center of the brain, increasing the neurotransmitter dopamine. As seen from this slide, serotonin contributes to a wide range of functions, including sleep and wake cycles, libido, appetite, and mood regulation, while dopamine is important for attention, motivation, and goal-oriented behavior. It acts to reinforce behaviors that make you feel good. Let's talk a little bit about the endocannabinoid system. There are three basic components of this ECS. Cannabinoids, also known as neurotransmitters or acting like neurotransmitters, are any compounds, natural or synthetic, that interact with the cannabinoid receptors. Then, in this system, there are also cannabinoid receptors, and the third component are hydrolytic enzymes that break down endocannabinoids. The endocannabinoid system is involved in many physiological processes, including cognitive processes, control of appetite, pain cessation, memory and mood alteration, sensory and time perception, and pleasure, among other things. There are 4 different types of cannabinoids. There are the endocannabinoids. These are produced naturally by the body. Then there are the phytocannabinoids, found in cannabis or other herbs or plants. Tetrahydrocannabinol, or THC, is the active ingredient, but there are also other non-active CBD components. We also have synthetic cannabinoids. These are lab-made chemicals that are meant to resemble cannabinoids. And fourth, there are cannabimimetics. These are compounds that act on cannabinoid receptors but do not resemble cannabinoids. These are found in some medications and synthetic blends of marijuana. So how do these compounds interact in the endocannabinoid system? CBD and THC bind to receptors and act like neurotransmitters that send messages to the nervous system and the ECS, the endocannabinoid system. Endocannabinoids are endogenous lipid-based retrograde neurotransmitters that bind to the CBD receptors, and there are several CBD receptors. An increasing body of evidence points to the importance of the ECS as a modulator of many physiological processes. What is the mechanism of action of cannabinoids? First of all, they act on various parts of the body, as evidenced by the widespread distribution of CB1 and CB2 receptors. Additionally, they can act as secondary messengers based upon the adenyl cyclase pathway. Cannabinoids affect the transmission of messages between nerve cells. As this diagram shows, CB1 receptors are located in various parts of the body: the brain, brainstem, basal ganglia, thalamus, hypothalamus, the thyroid, upper airways, liver, adrenals, ovaries, uterus, prostate, and testes. CB1 and CB2 receptors are located in these types of cells in the eye, stomach, heart, pancreas, and digestive system, and in bone. THC is a cannabinoid found in cannabis. It is the principal psychoactive component of cannabis, and it mimics the action of an endocannabinoid found naturally in the body called anandamide. Think of THC as a compound that overstimulates this endocannabinoid system. It modulates the release and reuptake of neurotransmitters such as serotonin and dopamine, thus contributing to alteration of mood, cognition, and motor function. The mechanism of action is that THC acts both at CBD1 and CBD2 receptors, primarily acting its mood-altering ability through its agonism of the CB1 receptor. CB1 receptors in the brain are found in the hippocampus, where they affect memory, the amygdala, which affect mood, the hypothalamus, which affects appetite, the nucleus accumbens, which acts on the reward center. As discussed earlier, THC can reduce the release of neurotransmitters such as GABA and glutamate that can affect mood, pain, cognition, and motor control. Some short-term effects of THC include the euphoria or high, an altered perception of time and space, increased appetite, relaxation, a heightened sensory perception of colors and sounds, Some long-term effects include tolerance and dependence, cognitive impacts during adolescent use or with adolescent use, and the possible risk of future psychosis. Some of the side effects of THC include impaired coordination, short-term memory impairment, redness of the eyes, dryness of the mouth, a feeling of anxiety or paranoia, and a very slowed reaction time. The effects of cannabis on our patients is widespread and variable, and it depends on the strain of the cannabis that they're using. Most of our patients probably don't even know which strain they're using. Most likely it's a hybrid, which makes attempting to determine anesthetic considerations very difficult because of the widespread effects. So in patients that use cannabis, it is again important for them to refrain for 72 hours prior to elective procedures. Thank you for joining us today for another episode of Anesthesia DDS. We look forward to talking to you in the future and presenting topics on local anesthesia, malpractice prevention, and other interesting topics of anesthesia as it relates to dentistry. See you again next time.